The second major capacity we would like to build moving forward for MedTap is the rapid research and data analysis components. And our director McCarthy has already identified one strong interest on pharmaceutical analysis for MedTap. That is to research best practices and impacts on health outcome. In specific, the subject area is to using the Ohio Medicaid pharmaceutical data or Ohio Medicaid data to determine whether the prior authorization for antipsychotics is necessary or cost effective. So this is an area that we will be moving forward rather quickly to conduct the analysis. And we also have a ongoing relationship with university to conduct retrospective drug utilization review. This is a federally required program component and also funded through MedTap. Another budget-related initiative that fit under the rapid research and data analysis is the dual eligibles initiative. If you are following budget closely, you probably are aware of Chuck Milligan did a study and a presentation to Ohio Health Office of Health Transformation, utilizing other states' data, non-Ohio data, to compare cost-effective care setting for dual eligible for Medicaid and Medicare population. And our director is very interested in duplicating this research for Ohio and hopefully to support our policy decision. There are several areas also designated to MedTap. One is the clinical expertise. We hope that we can work with you to have very rapid clinical consultation and technical assistance. One example would be that there are many interest parties sometimes will come to knocking on our door to tell us, hey, this procedures or regimens perhaps cost just $50,000 for Medicaid, but would save Medicaid $500,000. And at a time that we wouldn't know, have knowledge base about those specific new procedures. So hopefully we can turn to you rather rapidly to get us some education and also teaching us what those new procedures about, and perhaps those areas will be considered for inclusion for Medicaid benefit packages. Another hot topic is related to accountable care organization. Is also a budget initiative. And this is probably the conversation is happening throughout the nation. You can see every day there are new discussion happening. We would like to utilize your support to help us conduct a critical environmental scan and literature review and research the best practice models across the country, those emerging best practice model, and focusing specifically on the risk level and payment structures for different settings. One is hospital, one is physician-based, and one is HMO-based. And we'd like to contrast those models and see what is best fitting for Ohio, and focusing on the pediatric population. Ohio Medicaid also have an interest in full risk model. So those are the area of interest that we hope that we can utilize your support. There are also some other research and data analysis area that's under quality strategy. Traditionally, there are consumer survey conducted throughout the years, and Ohio Family Health Survey, in fact, is a MedTap sponsor survey, and there are also some other surveys that under quality strategy that helping us to gauge the patient satisfaction and then patient opinions. So those will be ongoing. And there are also care coordination strategy that's under work right now under the quality strategy to integrate the dual eligible. The final but not least area is the meaningful use. This is also one of the key areas identified by quality strategy. We would like to assist Medicaid providers to achieve meaningful use benchmarks, in specific on implementing electronic prescribing, focusing on drug interaction, drug allergies, and computerized provider order entry, and also to utilize the electronic health record decision support system, provide appropriate medical information communication among providers, and as well as empower patients to implement some strategies to allow patients to access their medical information. So those are the kind of current thinking under the meaningful use.